name is Dr. Zishan and I'm a 4th year resident anesthesia in MH. Today I will be making a video on how to pass CVP on a neonate. So we have this neonate who is in septic shock and he's on vasopressin and dopamine infusion to maintain his MAP. And he has no peripheral line for his infusion, so he has been consulted to pass CVP. So in the main OT today, we will pass CVP on this neonate, and I will be demonstrating each and every step in the video. So we have this patient. Can you please show this patient? So we have this patient. He's an extremely low birth rate, and these are his vitals. As the patient has no line, so we won't be sedating him and we won't be giving him any ISO or SIVO, because we don't want to risk any side effects of the inhalational or either intravascular medication. So we will start, and step by step I will be demonstrating step. Pause. Okay?
Yes, sir.
So we have sterilized the patient, and we have also kept the ultrasound with it. So first we will see his IGV from the ultrasound. And as you can see, can you take it to the ultrasound? And as you can see, he has a very collapsing IGV, almost 0.1 centimeter in, maybe you can say 0.1 centimeter whole circumference. So we will insert our CVP in this right IGV. Pause. We will be first inserting this IV cannula inside the internal jugular vein through ultrasound. So step by step, I will show you my needle tip in the ultrasound, and can you please show the this is our right IGV. So I am inside the IGV. As you can see, my tip is inside the IGV, and I'm slowly navigating my needle in the IGV. As you can see, I haven't pulled out my needle yet, so that it is confirmed, and I'm slowly navigating my needle. You can see a tiny tip in the center of IGV. This is right IGV. So you can see a bright thing in the center of it. It is very near the internal carotid artery. So I have placed it inside, and there is a blood coming out. So we will measure this guide wire length like this, and then we will insert the guide wire inside. The guide wire is going in smoothly, and we will take out the this cannula. After taking out the cannula, we can again see the diameter with this. As you can see, it's inside. You can see the tip, it's inside this. As you can see in the ultrasound, the tip is inside this shiny dot. This is guide wire, it's still inside. So now what will we do is that we will dilate it. So for dilate you always need a blade, because you don't want to kink your dilator or your guide wire while so you have to be very gentle when you have to insert the dilator, because it can kink. So you can give a small incision and then you can insert the very gently. You don't have to force at all. You have to use a very gentle and very slow. You never apply force when you are when you are just little bit, you feel a pop and that's it. You have to come back now. That's it. After that you have to insert the CVP. You have to keep the guide wire in place, and you have to and it will come over here, and now now it is over here, so now you can advance it ahead. Take it all the way in, and then you can take out the dilator. After you have taken out the guide wire, after you have taken out the guide wire, you will check it, all the 3 ports. Can you please hold this? Yes. Now we will check the ports, all the 3 ports. The blood should come in all the 3 ports. So the blood is coming in here. You can see it on the green port. So that's it. So our 1 port is working fine. Then you will check all the 3 ports and see if it's working or not. The second port, the blood is also coming in the second port, so that's pretty good. And the third one, you can also see the blood is coming in the third one, so that's pretty good. All our 3 ports are running. The CVP is in. Now the steps come, and now you have to close your ports as soon as possible so that the stability is maintained. And so we have placed the usually we place the CVP under the influence or SIBO, or maybe give little bit sedation, but due to this child being no CVP, we couldn't do it with any sedation. So now we will just make sure while stitching, just make sure that your sudden movement doesn't pull out the CVP. So we be very careful when, just hold this, yes. Be very careful when you are stitching, because stitching is also a very painful, but it is a very important part, and you can't you can take this stitching very lightly. So can you hold this tip with other hand? Thank you. Hold it. Just make sure it's tight, because if it's not tight, it can easily come out. Because it's so very small, it can easily come out. So just make sure it's stitched very properly. Usually 3 stitches are okay for this CVP. We have the second stitch to fix the CVP. So usually in adults we put maybe 2 stitches or 3 stitches, but in infants you definitely have to have 3 stitches, so that it doesn't get misplaced, or it doesn't get kinked, or it doesn't get even out with the small pull. And the last one, you have to place, I usually do this, that I placed it in the middle so that it's like fixed very good, very carefully, not any deep. Yeah, like this. I haven't taken out this key. This patient has altered PT-PTTK is very deranged, but he needs transfusion and there is no line for transfusion or for this. So we have taken the risk of CVP with low platelet count, and they are not that low that, but with expert hands in single prick, if it's possible, then you can try it. But if the procedure is very difficult and the lines are also low, and you think that you might not do it in single prick, then I don't think so that such procedure should be attempted, because this is a very difficult procedure. After securing each and everything, you can again sometimes see the CVP in ultrasound. Sometimes it's visible, and I can show you. Yeah, you can see the CVP. It's in the bright portion, as you can see in the middle. This bright portion, it's inside this IGV. You can also see it in the middle of it. You can see. Can you see it in the middle of it? So that is like confirmed. We have confirmed it. Other than that, we can also confirm it from the backflow method and everything. But when you have ultrasound, you don't need to confirm it with background method. So we have to clean this all the blood and make sure there is no and make sure you always have can you cut it in more small? And always have a transparent dressing on the CVP, so that if there is any bleeding or if there is any redness or swelling, you can have you can easily know. And then after that, you will put the this dressing on it. So this was CVP, passed a CVP on a neonate of 3 days old. He was in septic shock, and they wanted to start vasopressin and ionotropic support for this patient, and they didn't have any line. So we passed central line of this patient. It is a very difficult procedure, but if you follow the steps that I have mentioned, I think that such procedure can be carried out with ease. There are also other steps like needle. You can insert your guide wire through the needle, but I found it easy when I pass it through the cannula. So that is way better. Thank you for seeing the video, and